Hello, everybody. Welcome. Thanks for joining us today. Thrilled to be talking about some weight loss techniques today with our special guest, Dr. Stephanie Behringer-Massera, who's an assistant professor of endocrinology here at the Icahn School of Medicine at Mount Sinai and at Mount Sinai Beth Israel. Welcome.
Hi, good morning. Thank you so much for having me. I'm glad to be here.
Thanks. It really is a pleasure. And obviously we collaborate on a lot of patients. I send you lots of patients, and it feels like all day long in my primary care practice, certainly I'm having conversations about weight loss techniques and ways for people to eat healthier, be healthier, and really maintain a healthy weight for them. So I'm really delighted to have you to be able to talk about that a little bit. And I mean, maybe the way to start is really just sort of thinking about like, what are sort of your like key thoughts about the what it takes to really do good weight management?
Sure. So whenever people come to my clinic to talk about their weight, I always highlight the importance of really the base of weight management, which includes habit changes. And habit changes are very difficult to achieve. As we know, they take time. They usually require small steps, small changes at a time. And they're really made up of the 4 pillars of weight management, which include diet, exercise, sleep, and stress management. And everyone who comes to see me talks about how they do want to see the numbers on the scale improve or come down. But really what they hope for is good long-term health, and they want to be able to maintain that health. And so for that reason, it is really incredibly important. I cannot highlight this enough, how important it is to talk about lifestyle changes first, to make sure that medications are optimized, that any endocrine abnormalities are addressed and treated before advancing to any more aggressive measures.
Right. So before we talk about medicines and surgeries and all these things that are on people's minds, like what kind of advice do you have for people who feel like, they're eating okay, they're maybe not getting as much sleep as they want, they feel stressed out? Like, how do you approach each of those things?
Sure. So a lot of people who come to see me are really confused about what they've read on the internet. There are a lot of diet wars going on, and it becomes very confusing. I think when you take away all the noise and take away all the ways that the diets are different and look at really what they have in common, you'll see a theme, which is that almost everybody recommends to avoid processed foods. We should not be eating processed foods. And our diets should be, the staple of our diet should be plant-based foods. So whole grains, beans, lentils, vegetables, fruits, nuts, and seeds. If 70% of what you eat could be just that, you would have huge benefits to your health. So that's where it comes to diet. Then, of course, where it comes to exercising, everybody's weight loss journey is so unique. Everybody has certain concerns where it comes to aches and pains. And so we take that into account. Not everybody is able to pursue an aggressive exercise regimen of 200 minutes of aerobic exercise per week. And so we look at that very closely and work together with people's physical therapists and the abilities that they have and the resources that they have.
In terms of exercise, like I often tell people to just add in activity wherever they can to, get off the subway an extra stop early or to park at the far end of the parking lot. I mean, is that the right advice, to just like burn calories wherever you can?
That is exactly right. And I really encourage people to turn their homes into their gym. Make the place where you spend most of the time the place where you're most physically active. You do not have to get a gym membership, even though that would be great. But if you can dedicate a certain amount of time in your day every day and show up to that time every day to do even just 10 minutes of some light exercising, that is a huge change in your habit, and will lead to great benefits in the long term. So I really do encourage people to do exactly that, to get off the subway a little sooner, to take the stairs where they can, and to use what they have around in their home to do some exercises.
That's great. And then for diet, I mean, are there I love the idea of like cutting out the processed foods, which is sometimes easier than others.
Sure.
And is it also, is there stuff people can add? Is it really just adding more fruits and vegetables and high fiber things? Are there things that people get hung up on that, that sometimes you see as like an easy win?
I feel that people get very concerned about protein intakes and focus a lot on making sure that they get a lot of lean meat in. I find that eliminating foods from a diet can feel very restrictive, and so
Mhm.
that's why I do encourage people to start incorporating certain foods, such as the whole grains, beans, lentils, vegetables, fruits. You can get sufficient amounts of proteins from plant sources. Unless you're a growing teenage athlete, you probably don't need a whole lot of protein and can get your daily intake of necessary protein in very easily with just the foods that you eat.
Got it. All right. So we did two of your four pillars. We did diet and exercise. So what about sleep? What kind
So
of advice
sleep,
do you
yes,
have for this?
sleep unfortunately is ignored very often. It's felt to be kind of an unnecessary burden. You have to sleep when really you have so much other things to do, and sleeping is considered somewhat of a lazy activity. But you can have the most pristine diet and not lose a pound, just because the effect of sleep on your mental well-being, even on your gut microbiome, on cognitive function, on it cannot be on cravings, is incredibly is huge. And so I really encourage people to make sure that they're getting about 7 hours of uninterrupted sleep per night. And we try to talk about sleep hygiene to eliminate any factors that might interfere with their sleep, any medications that might interfere with their sleep. Sleep is incredibly important, yes, for weight loss.
Okay. And then stress management. The stressful
Right.
time. How do we get people there?
I think we all know what it feels like to come home from a stressful day and to look for some sort of a comfort for outlet of your stress. And when we eat foods that we know are not beneficial to our health. So emotional eating is certainly a big topic that comes up in our clinic a lot. But then again, people also have complicated relationships with food, for instance, and sometimes people don't want to discuss the numbers on the scale. And so when it becomes really challenging, I encourage people to use really all resources available to them, which includes, of course, talking to a therapist or considering cognitive behavioral therapy, which can be very helpful in establishing a healthy relationship with food. And by the way, also working closely together with our wonderful nutritionist, Dorina Cordonova, who can give all sorts of alternatives or replacements for foods that we typically crave, that will make us feel better. And I also encourage people not to feel bad about their cravings because we are hardwired to crave salt, fat, and sugar. It's how
Mm,
we survived and made it until to today. In evolution, it was absolutely necessary to feel hungry, to have these cravings, and to seek out these foods. It's just that they don't really work in our benefit anymore in the abundance that we live today.
right. And we talked about a lot of stuff. We didn't really talk about alcohol at all, which I think can have an impact on diet and maybe not exercise, but sleep and stress and stuff. Do you have a take on how I feel like sometimes alcohol can interfere with people's weight loss strategies?
Oh, absolutely. Yes. So alcohol can sometimes undo a lot of the efforts that you put into your weight management journey. And of course, also affect sleep. People sometimes, or alcohol is considered somewhat of a sedative that might be helpful to ease into sleep, especially if people experience difficulties with falling asleep. But it significantly decreases the quality of your sleep. And so I encourage people where they can to limit the amount of alcohol that they consume.
Limit it, but not to zero, just to
Not
less.
to zero. No. No, we all want to enjoy life and celebrate when there's a reason to celebrate. So absolutely, there's no need to cut out alcohol entirely, but to limit it.
Got it. So, I mean, these are great points, and it feels like a lot of these things are things that I talk about in primary care, or that we can talk about in primary care. How do we decide when somebody is at the point where they really need to see a weight loss program, an endocrinologist, a specialist to really talk through some of these things more in depth?
Sure. So once we've exhausted all of these lifestyle changes and feel that we haven't really achieved substantial weight loss, usually I go by a measure of about 5% of total body weight. If we haven't really achieved that goal, or when people start to feel frustrated, or they come with that expectation that they want to start a medication right away because they have a particular date coming up, a wedding, that they want to have a certain weight on that day, we then start to talk about pharmacotherapy. And I think it is important to highlight the importance or the role of pharmacotherapy. Oftentimes, even as healthcare providers, we shy away a little bit because we're not as familiar with some of these medications, or we're concerned of side effects. But if you consider that about 40% of the adult population in the US qualifies for anti-obesity pharmacotherapy, and only about 2% of this population is treated, that number is truly staggering. And if you consider that about 200 medical conditions are related to obesity or overweight, and obesity is responsible for 4 million deaths worldwide, primarily cardiovascular disease, then you'll recognize the importance and the value of initiating pharmacotherapy.
I mean, that's great, and I feel like I already have to watch this episode back again just to get all those stats into my head. But clearly, that's a great argument for using medicines to help treat obesity, even in primary care, I think. Can you take us a little bit in depth with, sort of the most common medicines, and how do you decide who's the right fit for which one?
Sure, I'm happy to talk about that. So when it comes to medications, I often tell patients that there are pills and there are injectable non-insulin diabetes medications. The clear champion among the pills is phentermine, which is a stimulant, and sometimes it comes in combination as a designer drug, fancy designer drug, Qsymia, which also works very well. The weight loss effect that can be achieved is about 7% of total body weight. Most of these medications work on the central nervous system by curbing appetite, and that is the case also with phentermine. It releases dopamine and norepinephrine, meaning it decreases locomotor activity. So even after a long day at work, you come home and you feel like you're ready to hit the bike or to clean out the house, and really decreases appetite significantly, so that the intake of calories is decreased. I highlight to people that it is important to, during this time, to really work together very closely with us on optimizing lifestyle factors, because after a while, most of these medications lose their efficacy, meaning that people feel that they don't hit hard as much anymore, and that they need to increase the dosage. And that is typically the time when we talk about maybe discontinuing the medication. Potential side effects of these stimulating medications are they can increase anxiety. So in people who suffer from anxiety, this medication may not be optimal. They can increase blood pressure and heart rate. So in people with pre-existing heart disease, they may not be eligible, and they're contraindicated in pregnancy. So these are some of the things to consider.
Got it. And some people, people who are old enough to remember fen might have a little bit of nervousness around phentermine. I mean, there's no real residual sort of worry about that?
Not to the effect as was the case with fen in the past, but certainly in people who have coronary artery disease or hard to control blood pressure, I avoid this medication.
Got it. All right. Phentermine's a winner, but limited in people with those conditions. What else is in your arsenal?
Right. And so the other champion in the weight loss medication world are the injectable medications, the GLP-1 receptor agonists, better known as Saxenda, Victoza, Ozempic, Trulicity, and the newest kid on the block is Wegovy. They're injected either once a week or daily. They significantly curb appetite by decreasing gastric motility. You feel full faster, you eat less. It improves insulin secretion, meaning that blood sugars can improve. And because there's an increase in satiety-promoting hormones from the gastrointestinal tract, it also works in a way centrally. It's a very nice drug. It's very safe. The most common side effect or complaint that people have is that it might cause some nausea initially, some diarrhea, sometimes constipation, but they can generally be prescribed very safely in the long term.
And how about insurance coverage? I mean, are insurance companies paying?
So the one heartache that I have with these medications certainly is the sometimes very challenging situation where it comes to insurance coverage. In people who have a pre-existing diagnosis of type 2 diabetes, these medications are generally more readily covered. But so Medicare's prescription drug program, for instance, excludes all weight loss medications categorically, which is regretful, really. And I believe that also because we're talking a lot about prevention of chronic degenerative diseases, the effects of initiating these medications in people who have obesity are not immediately apparent. It's not like with a blood pressure pill where the blood pressure is lowered immediately, or insulin where blood sugars are rapidly improved. And so it may not impact a certain plan year, which might be another reason why these medications are not necessarily as readily covered. And the other thing I believe is when most people think of obesity, they think of someone's appearance. And anything that has to do with appearance is considered somewhat cosmetic, somewhat unnecessary. And so I think that general attitude of, or that understanding of what the value is of preventing chronic degenerative disease and the importance of treating obesity, I think that awareness needs to improve.
Got it. Are there other medicines we should be thinking about? I sometimes hear about people taking like metformin, which, you know, is a diabetes medicine, maybe off-label for weight loss. Sometimes people use some other things to try to lose weight. Are there other things
Sure.
you're thinking about?
Sure. So people sometimes feel nervous about starting medications, and metformin, which is a diabetes medication, is a very safe medication and might put people at ease who feel a little bit nervous about the some of the controlled substances. And so metformin is safe. It decreases appetite somewhat. They have somewhat a modest weight loss effect, but can have, you know, people are so individual, and genetics certainly also play a role when we talk about weight management, so that some people can achieve very nice and substantial weight loss, even on the gentler weight loss medications, such as metformin or topiramate alone, which we also sometimes prescribe. One medication that I want to mention also is Contrave. Contrave is another combination pill of naltrexone and bupropion, also works centrally, decreases appetite, can enhance mood, can lead up to 5% total body weight loss, and is also one of the options that are there. Orlistat, which is over the counter, I'll mention, honorary mention, because it's very common. And then one of the newer medications, Plenity, which is a super absorbent hydrogel, works somewhat similarly to how some of the, like psyllium husks, for instance, that you take with a lot of water.
It's supposed to like absorb the water and fill your stomach so you feel full or something?
Exactly. It's actually considered a medical device because it has that mechanical effect.
And have you tried that? Have you had success with people with that?
I haven't. Only 2 people have approached me about this medication. I haven't been able to get it approved, but we then tried psyllium husks, and we're boosting their weight treatment with these additional medications or supplements.
Right. So psyllium husks, sort of going back to our diet discussion, like getting people on like Metamucil kind of stuff or whatever that helps keep them feel full, and adding fiber to their diet.
Exactly.
Even before they get to medicines could be a good solution to that. That's great. So when people come in and they're, sometimes people walk in the door and they, my friend took whatever and it worked and I want to start medicine right now. How do you sort of talk to people either who hadn't really thought about medicines before, and when do you say like, all right, you haven't lost 5% of your body weight, maybe we should talk medicines, or people from the get-go who are saying, I want medicines no matter what. How do you sort of balance how to talk to people about that?
Sure. So I first of all highlight the importance of how people are really very individual and how genetics play a role. Some people might lose a lot of weight on Qsymia. Other people might do better with Ozempic. And I had a scenario like that where a patient came in and really wanted to get Ozempic because their friend had lost weight on Ozempic. But we were having a very difficult time getting this medication approved. We then opted for another medication that worked wonderfully for her. But really, again, we talk about the importance of implementing habit changes because these are ultimately the things that will lead to sustained weight loss. And that is the overarching goal that everybody has. So while most of these medications will lead to some degree of weight loss, it is absolutely necessary to combine these medications with the lifestyle changes in order to achieve the goals that people have in mind.
Got it. And then And then I guess sort of the next step or a different option is really talking about surgery for patients. How do you decide when it's time to have that conversation?
Exactly. So sometimes people have that wish and come with that wish to me and talk about their frustrations with their weight loss efforts. And sometimes we reach that point also with people who've tried pharmacotherapy that they just haven't achieved their goal. I refer to a wonderful surgeon who works together with us in Union Square, and there can be huge benefits to advancing then to bariatric surgery. Most bariatric surgeries are performed laparoscopically these days, meaning that they're
So,
minimally invasive.
right. So like with the little cameras and stuff instead of
Exactly. So little incisions are made in the abdomen. Recovery time is very fast. The most commonly performed procedures are the Roux-en-Y gastric, the bypass surgery, sleeve gastrectomy, and the adjustable gastric band. And so
Can you
the
just
oldest.
take us through each of those maybe a little bit, just so it's hard without being able to draw pictures, but
Sure. Yes. Yeah. So where it comes to the surgery, the Roux-en-Y gastric bypass is the oldest surgery. It's been around for last 30, 40 years as pretty much the gold standard in the US. And what happens is the surgeon will staple the stomach into a small pouch the size of about an egg, so it holds about 30 cc's. Further down in the intestine is then separated and the distal part is pulled up to the new gastric pouch, and the proximal part is attached a little bit lower down then to the common arm of the intestine to allow the digestive enzymes to mix with the food. And so the weight loss that can be achieved can be quite drastic. Up to 35% of total body weight can be lost. The surgery is generally very safe. Immediate concerns would be infection, bleeding, thromboembolic events. The other surgical approach is the gastric band, which became wildly popular in the early 2000s. It's essentially a silicone ring that's attached around the upper part of the stomach and is connected through a port underneath the skin that is filled with saline to tighten the ring. The benefit of this is that you don't really change the anatomy of the person and can be reversed. So the weight loss that can be achieved is somewhat modest. It's about 15% of total body weight, and fell a little bit out of favor over the years because of some complications that occurred with the ring, such as erosion into the stomach or slippage, or problems with proper functioning of the port. So in terms of popularity, it was taken over by the sleeve gastrectomy, which is a very commonly performed surgery nowadays. And so what happens here is that the surgeon will staple the stomach into the size of a banana, and the remaining part of the stomach is removed, sent to pathology. And so you're left with a very small stomach, meaning that you can only eat a certain amount of food, calorie absorption is decreased, but you also remove the hunger-promoting hormones from the stomach. So it works two ways. And the weight loss that can be achieved is quite substantial, up to 25% of total body weight. There can be some nutritional deficiencies that might come up down the line, which can be supplemented usually. And so while we are looking here at the numbers on the scale, there are a number of metabolic abnormalities that can be completely reversed with the surgery, such as diabetes, high blood pressure, obstructive sleep apnea. That again might make management of lifestyle changes much easier. So somebody who sleeps better is much more motivated to exercise. Somebody who doesn't have to worry about their blood pressure as much might be less concerned about working out, and their mood might be improved. And so there are a lot of benefits that come from the surgery potentially.
Great. And then, I mean, in terms of people who qualify for the surgery, I mean, for medicine, it's a little, people who want to lose a certain amount of their, are obese, want to lose a certain amount of their weight. We talk about lifestyle and medicines. For surgical options, like a lot of the insurance companies have a specific threshold, right? Like a BMI of 40 or something to even be able to sort of get in the door for the surgeries, right?
You're right. So we go by the BMI. The BMI is a calculation of your weight over your height in meters squared, and gives us is a risk stratification tool. Tells us something what your risk is of developing chronic degenerative diseases that can be tied to your weight. And so in people who have a body mass index of greater than 40, these people qualify for the surgery. People who have a body mass index of 35 or greater with a weight-related comorbidity also qualify for the surgery.
So like diabetes, high blood pressure, things like that.
Exactly. Yes.
All right. Well, I think we did it. I think we ran the gamut of everything I need to talk to patients about. I really appreciate your time with us, and thank you, everybody, for joining us today.